To put this in perspective, you have a textured implant here that has a rougher surface and feels more like sandpaper. Some are thicker than others, so there's a macro texture and a micro texture. Both of them incite what we call a biocell reaction. The body is reacting to that textured surface, and it's that biofilm that in time can turn into a cancer. So less than 5% of the implants that have been implanted are of the macro texture variety, so relatively few. And again, we want to reiterate this too, that it's both the micro and the macro type of textured implants that have been associated with this type of cancer.
Lymphoma. Well, okay, so the question is, if you have textured implants, you call your doctor, you look at your device card, they're textured. Do you whip them out tomorrow? Is this an emergency? I think it's an individualized conversation. If women come into me with this question, they do have textured, and they ask me that question, the answer is, okay, let's go over some stats. That calms some women down to say, you know what? I actually look in the mirror and think, I'm looking good, and I don't want to mess with this. And you're telling me these rates are pretty low, and the symptoms, when I'm vigilant, are fairly obvious at an early stage where it's totally curable just by the surgery I'm thinking of getting anyway, right? So that woman can just watch and wait. Someone else who's still anxious, or maybe she's like, you know what? I've had my babies, my breasts are bigger and droopier, and these don't look so great. One's bigger than the other. I kind of wanted to tweak it anyway, or I'm over implants. Now the recall is pushing her toward surgery.
And really quickly, we did reach out to Allergan for a statement on the recall. They said, we are committed to providing patients, surgeons, and healthcare providers with the very latest information about the biocell withdrawal. It is important to note that the FDA and other health authorities have recommended not to remove or replace textured breast implants or tissue expanders in asymptomatic patients.
You know, on that note, our societies, American Society of Plastic Surgeons, American Society for Aesthetic Plastic Surgery, I mean, we're looking at these stats very, very carefully worldwide. And our position is now watchful waiting.
Yeah, they're not recalled out of bodies. They're recalled off the shelf. So this implant recall isn't like you've got a part in your car that the 10th time you drive it is going to explode you into flames. That's not what the recall is about.
But would you say this information would say to plastic surgeons who are using them to not use them anymore, because we know that there's that risk?
They can't use them anymore. So those Allergan implants have been taken off the market. I have a little bit different take on it, right? I think that the women should have their choice to do what they want.
Well, of course.
We inform them with the education and what needs to be tested, and they make the decision, not the FDA. They decide if they want the implants in or out.
Not our societies.
That's what I think.